Hey everyone, in this video, we're going to talk about neurologic medications. So what is the agent used for, mechanism of action? So what does the drug do, side effects, and then also how the medications will impact therapy. So some of the drugs we're going to go over are muscle relaxers, anti-spasticity, dopamine replacement, and then anti-epileptic. So muscle relaxers, they're used for muscle spasms. So some of the side effects are sedation and dizziness. Now, if you know the side effects, you can kind of put together how they'll impact therapy. With this duo here, they're going to be more likely to be a fall risk. The medications are big names here, but Flexeril and Valium. And why is Drake from Drake and Josh on the slide here? Whoa, take it easy. Whoa, just take it easy. This, I like to think of this, if you're able to put mental pictures to things, especially with medications with like names like this that are hard to remember, if you're able to connect it to something, then you're more likely to remember it. So in this case, if there's a muscle spasm, the muscle needs to relax. This is just a way that I remembered it. Now, for the second medication class, anti-spasticity, these are used to reduce muscle spasticity in upper motor neuron lesions. So think conditions like CVA, SCI, MS, and cerebral palsy. So like in this picture with how a CVA patient might present, they have too much tone. So these medications address that specifically. Some side effects are dizziness, hypotonia, drowsiness, and confusion. So kind of this triple thread here, dizziness, drowsiness, and confusion. They can make the patient more of a fall risk. Also monitoring tone, so that's an impact on therapy. If sometimes with these medications, they might have the opposite effect. So there's too much tone, and then they can cause the muscles to not have enough tone. So just keeping an eye on that because the muscles do need some tone to be able to contract, and collaborating with the physician regarding the dosage, just so the drugs are not doing the opposite effect of what they're supposed to do. And then medication being baclofen. Anti-epileptic agents. So these are used for seizures, all different kinds. We got grand mal, petite mal, and others. Mechanism of action, it's going to decrease the electrical signals in the brain. So with epilepsy, there's too much electrical activity. That's why there's a picture of a lightning bolt here. And then if you're able to associate this lightning bolt with all these different medications, just to kind of make it stick, some side effects are ataxia, blurred vision, dizziness, and drowsiness. So surprise, they're a fall risk from all of these side effects here. And also in clinical indication with this patient population is just knowing how to respond to seizures and identifying triggers. The medications, all of these here. Dopamine replacement. So these are used for Parkinson's disease in particular. Some side effects are dyskinesias, orthostatic hypotension, and restlessness. Impacts on therapy. So sometimes the timing of these medications are going to be important for therapy. So scheduling therapy about 1 hour after taking this medication is going to give the best therapeutic effect. So you're able to get to work with the patient in a more therapeutic capacity. Also monitoring vitals just because they do have that orthostatic hypotension. So changes in blood pressure with positioning. Some medications are Sinemet and Requip. Now, pharmacology is not an easy class by any means and is sometimes very boring. These are 4 strategies that helped me, and I have some examples coming up. So you have memory palace. This was where you associate a mental picture with the medication. So think like the muscle relaxers with the Drake and Josh reference, and then the anti-epileptic drugs, the lightning bolt, just to picture that. And putting together, so grouping the signs and symptoms, if you are able to put together like a Venn diagram, so comparing and contrasting the drugs, you're able to kind of keep in your head what's similar, what's different, and then also making it salient. So visualize the patient population who are going to be using this medication, and then what kind of medications they'll be taking. Anything that helps you build connections with either the mental picture or actually visualizing the patient population that uses drugs like Sinemet. So this is the memory palace example, having just different pictures for different medications. That way you're more likely to remember it. And then this is the compare and contrast strategy with the Venn diagram. So comparing the what's different, what's the same, and then that way you're more likely to remember on exam. Okay, gabapentin was for nerve pain and it also causes dizziness. You can kind of go back and forth with those two. So just a sample question to wrap it up here. An inpatient physical therapist is chart reviewing a patient post-cerebral palsy or post-stroke. Which medication is the patient most likely to have in their chart that's used to decrease spasticity and promote muscle relaxation? A, gabapentin, B, Flexeril, C, baclofen, and D, Requip. So I'll let you guys answer that question here. And the answer is baclofen, keywords being post-stroke, and then what it's used for, so decreasing spasticity and promoting muscle relaxation. So this definitely isn't an easy concept. All pharmacology is not an easy topic to learn, but there are some strategies that can help with like the memory association, mental pictures, and also comparing and contrasting the different medications, making it salient. So having the patient population in your mind as you learn the drugs can also be helpful. Honestly, whatever helps you remember it, making up stories. People get creative with it. So alrighty, thank you guys for watching and tune in for more videos like this. Leave a comment if you found this helpful and you want to see more videos like this.